Tracy, as promised, following on from our telephone conversation this morning, just sending you a quick video of a few kind of do's and don'ts with your knee. Just seems an easier way of doing it rather than trying to explain everything over the phone or online on Skype. Okay, so what's likely to have happened to your knee with that fall and twist of your knee? What you've probably done is sustained like a soft tissue injury to the outside part of the knee. Okay, these very often respond just to time, okay, and after 6 weeks very often they've gone. Okay, sometimes that's not the case, and in your case you're 7 weeks down the line and this is still quite a significant problem. Okay, so the initial injury you've probably sustained is a ligament injury to the outside ligament, so your lateral collateral ligament. Okay, so alongside that, what you're now developing, I should think, is a very tight kneecap, your patella. So, okay, so instead of your patella moving quite freely, it's likely to be kind of quite stuck down on your knee, and your quads are likely to be tight, so is your lower leg as well. Okay, so a few things really important to work on at this stage. So you mentioned on the phone that you're really lacking that full extension. Okay, so that getting that knee completely straight. The problem with this, if you're unable to get your knee completely straight, is that you're unable to kind of fire off your medial quad, so your quad on the inside part of that knee, and that makes your knee very unstable. Okay, so I should imagine the reason why you're actually collapsing and falling when you walk is that you're walking on a bent knee, which is not a stable knee. Okay, the way we walk normally is we lock our knee out a lot more, and that gives us our stability. Okay, so it's unlikely that you've actually ruptured ligaments, which is causing that instability. It's possibly likely to be lack of range, lack of muscle firing as well. Okay, so first thing we really need to do with your knee is to get it to straighten. Okay, so a couple of things you need to be trying to do with this. Okay, so get yourself a rolled up towel. Alrighty, okay. So the first exercise, without the towel, okay, you're possibly in this position, is we just want to be encouraging that knee to go flatter. Okay, so you can just do little movements just to pushing it as straight as you can. Okay, try to avoid lying or sitting with something under your knee. Okay, because that's just encouraging more flexion of the knee. So when you sleep or when you're sat, try to kind of get rid of everything. So gravity is assisting that knee extension as well. Okay, so initially you want to just try and kind of squeeze that knee just actively down. Okay, what you can try and do then, if it's comfortable enough, pop a towel just under your heel. Pop your heel up on a towel. Okay, so again, gravity is going to assist you in this movement. And again, you can relax it down into that extended position, and you're trying to squeeze those muscles here just to kind of get your knee extended. Okay, so at this stage, we want to be trying to kind of push that knee as straight as we can. Okay, so it is a little bit of no pain, no gain with this, because we need to get that knee straight. We need to get those muscles firing. We need to get that knee functioning much better. Okay, so relax in this position and then just try and kind of push that knee straight. Okay, what you can do is you can pop your hand either side of your knee, not on the knee, just either side, and then just try and push it down. Okay, can get someone to do this for you at home as well. Okay, so initially if you're getting someone to do it at home, get rid of the towel. Okay, so you're not going to go any further than just completely straight. Get them to put one hand lower leg, one hand above your knee, and then they can just do a few little pushes. Okay, find the gentlest person in your household first of all. Okay, and have a go with that. Okay, so the key thing is to try and get this knee firing. As I said, if I push my knee completely straight, you can see my quads kind of working there. If you're lacking that range, then these muscles are just going to kind of fatigue, and they're just going to get weaker and weaker. Okay, and you're going to get lots of what we call atrophy, so just a shrinking of the muscle. Okay, so talking about your kneecap, yeah, you're likely to have quite a bit of stiffness around your kneecap. Okay, so compare it to the other side. So your left knee, make sure you're nice and relaxed. You should be able to wiggle your kneecap from side to side. Okay, with your painful side, then this might be a little bit stuck. Okay, so make sure you're nice and relaxed by testing on your good side. And with your affected side then, see if you can wiggle your knee from side to side. Okay, so at this point now, you want to be working a little bit with the pain if we need to, okay? So if you need to ice it first, if you need to put a bit of heat on it first, if you need to take some painkillers first, let's mask the pain and get this knee moving much better than it is now, okay? So spend a bit of time, a couple of times a day potentially, just wiggling your kneecap up and down, okay? You can also just try wiggling it up and down that way. So side to side, you want to be wiggling it, okay? So in that position then, you bring your knee up here, okay? And just kind of work around the soft tissue just above your knee, okay? You might have some tight areas in there, okay? And likewise, just lower leg as well. If you find anything particularly tight or tender, then stay on that point, yeah? And then put a bit of pressure through there, hold it for a good 10 seconds or so, relax, move a little bit, go again. Okay, so you're releasing some tightness and what we call trigger points around that area. Okay, so far we've tried to get the knee straighter, we've worked on your kneecap a little bit, and we've done some soft tissue work down here, okay? So the next thing we want to be working on is obviously flexion of your knee, okay? So just coming into this position here, okay? You said you comfortably got about 90 degrees, which is there. Pop your hands on your leg like so, and then just give it an extra little pull up towards you. Okay, so assist it with your hands and pull up as far as you can. Okay, so again, go into that stretch, into the discomfort a little bit, not too far into that discomfort. Hold it there and relax back. Okay, with your movement exercise, especially extension, at the moment you want to be concentrating really on 3-4 times a day with that. Really kind of emphasize kind of getting that back. Without those muscles activating, okay, and that knee getting straight, it quite limits what you can do on your next stage. Okay, so stage 1 is getting that knee as straight as you can. Okay, so stage 1 is all about getting extension back, bit of soft tissue work here, get your kneecap moving and getting your bend better. Okay, so quite simple ones then you can do in the chair. Okay, so sit in the chair. Yeah, again, we can work on our movement in the chair. So you can bring that knee back as far as you can. Okay, and then as you bring it out, I'm going to straighten it as much as you can that way. Okay, so we're going to bend it back, nice and simple. If you're working from home, really easy one to do on your computer desk. And back. Okay, so just there, back and forth. Again, if you're struggling with your extension, you know, you're probably only going to get to about there, okay? That's why we're going to be taking it down to stage 1 is trying to get your knee extension on the floor, getting someone to help you and push that down into knee extension as much as we can. And relax there. Okay. So standing and sitting from a chair, obviously very functional exercise that we can't avoid, okay? So we can turn that into a bit of an exercise as well. So if we find that sitting and standing from just a normal chair is too painful at the moment, okay, grab a couple of hard back books, okay, so quite thick books, and make your squat a lot shallower, okay? So when you're sitting and standing, you're literally going from this position, okay? So you're just doing a nice shallow squat, okay? And with that one, use pain as your guide with that one, okay? So don't push too far into the pain with your squatting. Okay, and another one you can do just on the bottom step, stand your bottom step, okay, and then just toe tap initially, okay, so that's just kind of stage 1 of that exercise, okay, and then stage 2 would be just a normal step up, step down, okay, leading with your right leg. Okay. So I think plenty to get on with there. I'm not giving you loads of exercise to do because I really think that in the next week we need to be concentrating on that extension that I've kept on going on and on about, okay? So have a go with what I've suggested now today. What I will send out as well, I've done a video previously with some thoracic stretches, okay? So stretches for your upper back. So quite nice to do if you're working from home or if you've been on a crutch and you've been quite hunched with your upper back. So I'll give you those stretches as well, so maybe have a go with those. Okay, so as I said, give these exercises a good go in 5-7 days time, and in 5-7 days time, get in contact, let me know what that extension's like. Okay, so as I said, the way we progress these exercises is based on how your knee is actually moving first. Okay, so I'll speak to you soon.